The most critical moments in a medical emergency often happen before professionals get there. When someone collapses, struggles to breathe, or suddenly feels severe pain, people usually reach for their phone and call for help. That's the right first step. But after the call is made, there are often several long minutes before the ambulance arrives. In those minutes, many people feel helpless. They panic. They wait. They hope nothing gets worse, but the truth is that those first minutes can make a significant difference. Knowing what to do before medical professionals arrive can help stabilize a situation, reduce risks, and sometimes even save a life. This isn't about replacing doctors or paramedics. It's about understanding a few simple actions that can help protect someone until trained help reaches the scene. Let's walk through what you should do during those critical moments. The first step is simple but essential. Stay calm and assess the situation. In an emergency, panic spreads quickly. If several people are present, everyone may start talking at once or moving around without direction, but staying calm allows you to think clearly. Take a moment to look at the person and the environment. Ask yourself a few basic questions. Is the person conscious? Are they breathing normally? Are they bleeding? Did they fall or suffer an injury? These observations help you understand what kind of emergency you are dealing with and guide the next steps. If you've already called emergency services, the operator may ask these same questions. Being able to answer clearly helps them provide better guidance while the ambulance is on the way. The second step is make the environment safe. Sometimes the emergency itself isn't the only danger. For example, if someone collapses in a kitchen near a hot stove, or falls in a garage near tools or chemicals, the environment may pose additional risks. If possible, remove hazards around the person. Turn off nearby appliances. Move sharp objects out of the way. Create space so the person can lie comfortably without obstacles. This also makes it easier for paramedics to access the person quickly when they arrive. The third step is check breathing and responsiveness. Gently speak to the person. Ask simple questions like, "Can you hear me?" or "Are you okay?" If they respond, that's an important sign. If they do not respond, observe their breathing carefully. Look for the rise and fall of the chest and listen for normal breathing sounds. If the person is unconscious but breathing, placing them carefully on their side can help keep the airway open and reduce the risk of choking. If the person is not breathing normally, the emergency operator may instruct you on how to begin CPR until help arrives. Even basic CPR can help maintain blood circulation during those critical minutes. The fourth step is control any visible bleeding. Severe bleeding is one of the most urgent situations in first aid. If someone is bleeding heavily, the priority is to apply firm pressure directly on the wound using clean cloth, gauze, or bandages if available. Pressure helps slow the blood flow and allows the body to begin forming clots. If possible, keep the injured area elevated above the level of the heart while maintaining pressure. Do not remove the cloth if it becomes soaked with blood. Instead, place another layer on top and continue applying pressure. The goal is simple. Reduce blood loss until medical professionals arrive. The fifth step is help the person stay still and comfortable. Movement can worsen certain injuries. For example, if someone has fallen and may have injured their neck or spine, unnecessary movement could cause additional harm. Encourage the person to remain still and relaxed. Speak calmly and reassure them that help is on the way. Sometimes emotional reassurance is just as important as physical assistance. When people feel supported, they are less likely to panic, which helps stabilize breathing and heart rate. The sixth step is gather important information. While waiting for the ambulance, try to collect details that can help the paramedics. For example, what symptoms started first? When did the problem begin? Does the person take any medications? Do they have known medical conditions or allergies? If medication bottles or medical information cards are nearby, keep them ready. Providing this information quickly can help paramedics make faster and more accurate decisions when they arrive. The seventh step is clear a path for emergency responders. This is something people rarely think about during an emergency. Make sure the entrance to the home or building is accessible. Unlock the door if possible. Move obstacles out of the hallway or driveway. If someone else is present, ask them to wait outside and guide the ambulance crew inside. Every minute counts in a medical emergency, and easy access allows responders to reach the patient faster. These steps may sound simple, but together they form a powerful principle. In most emergencies, the first few minutes belong to the people already there, before professionals arrive. Family members, co-workers, or bystanders become the first line of response. You don't need advanced medical training to help during those moments. Staying calm, protecting the environment, checking breathing, controlling bleeding, and gathering information can all make a meaningful difference. These actions help stabilize the situation and give emergency responders the best possible starting point when they arrive. Many people assume emergencies are rare. But everyday life is full of unpredictable situations. Falls, allergic reactions, sudden illness, or accidents can happen at home, at work, or even during routine activities. Being prepared doesn't mean expecting the worst. It simply means knowing how to respond when something unexpected happens, and sometimes, that knowledge is what turns confusion into calm action. If you found this information helpful, consider subscribing to the channel for more practical guides about everyday health and emergency preparedness, and if you want to explore this topic further, there's also a resource linked in the description that explains many common medical situations and how people can handle them step by step at home while waiting for professional care. It's a useful reference for anyone who wants to feel more confident during those critical moments when help is on the way.